我是韩国梅小卫牙科院的林尚洲院长，欢迎你来到济州岛，欢迎你来到Dentium JEJU Festival. Today, actually, I brought my theme. My subject is here: various clinical application of Dentium Collagen Graft. That is brand new collagen graft materials and regeneration materials. About the GBR procedure, actually before starting introducing the collagen graft material, and first of all, I want to say, I want to introduce about this GBR procedure. What is GBR? As you know, this membrane working, some of main role to protect this bone graft material and the induce newly forming bone. So the barrier membrane is very important role in this GBR, the conventional procedure. So conventional GBR procedures, as you know, bone graft materials added collagen membrane. So this collagen membrane serve to exclude epithelial and connective tissue cells and also stabilize the blood clot and the graft materials. And finally, support osteoblastic proliferation. Finally, we can get the very nice, well done, regenerated new bone formation during this procedure. So let's see this extraction case actually already done by root canal treatment. However, it is failed prosthetic part. So I have decided extraction and implantation. Unfortunately, during the extraction, the labial bone were completely gone away. So we have to plan about this GBR procedure. Fortunately, I'm going to do the contained defect when I have implantation. So implantation first, and as you know, bone graft and the membrane. And for the stability, for gain of stability, as you know, this stability is very important part and the considering factor. So I used pin here. And the suture, the primary closure, so always try to have a primary closure. And the waiting period is essential. During 4 months, sometimes we need more time, 4 months. So 6 to 7 months depend on defect size and situation. Finally, after 6 months later, we can get the very nice newly forming bone around this defected area. So these past principles, as you know, this primary closure, angiogenesis, and space maintenance, stability, all of these 4 factors are important to have a very nice, good result when we have a GBR procedure. This kind of procedures rule all this conventional technique of GBR. So here, and the final prosthesis. And the implantation, and we can get the labial bone plate with a codification. That is one of the clue of a success of GBR procedure 4 years later. However, now I'm going to introduce about the brand new graft materials. Actually, instead of collagen membrane, I want to say about this Dentium Collagen Graft. What is collagen graft? Collagen graft is resorbable collagen matrix from the porcine tendon, and the structure have a bilayer, the dense layer and porous layer, the bilayer structure, and the degradation time, almost 1 month. It's actually, sometimes more than 4 weeks, and sometimes a little bit the earlier resorption depend on situation. Handling is perfect, wonderful, and the size available depend on the defect size. That is collagen graft. The dense layer and porous layer, the bilayer structures, and the company doesn't have any recommendation about this bilayer usage. However, for me, actually, I always try to dense layer the outside, the face to outside, just inner plexi, the positioning. That is better to get the better result. So about the healing timeline here, the key words of healing advantages here. Why? Why do you want to use this collagen graft instead of collagen membrane? Simple. First one, the rapid epithelialization. Second one, the vascularization support. And finally, we could get the predictable result. Very nice, newly-forming bone with a simple way. So the rapid epithelialization is important advantages, big advantages compared to the conventional collagen membrane. That is the structure, the collagen graft, dense layer, and the porous layer. X1D, 2D, 3D is already launched to our market. What is different? Actually, 2D is 2 times bigger, 2 times denser, the density. Depending on collagen density, we named 1D, 2D, 3D. And the thickness is different. The normally 3 millimeter is a general, the regular thickness. So how can we apply this collagen graft? The indication is everywhere. When you have a bone defect, even though the GBL, the collagen, soft tissue augmentation or socket preservation, doesn't matter. Everywhere we can use this collagen graft as a versatile material. Rich preservation, extraction socket, augmentation keratinized gingival, and the pre-gingival graft alternative. And also, we can apply root coverage procedure and also GBL procedure as well. So that is collagen graft. The very nice soaking by blood or the sum of the cell line and sometimes PDRN. Biocompatible, and so to promote soft tissue healing, that is key factor and the key advantages when we choose this collagen graft in the defect site. So how can I apply this collagen graft? First of all, I'm going to introduce about this alveolar ridge preservation. As you can see, elder patient, 78 years old, elder patient. For me, actually, I always try to do this collagen graft for elder patient first. Why? Younger generation, it doesn't matter. Big surgeries and big flap and periodontal releasing incisions doesn't matter. The higher recovery potentials cover all of these complex or complicated situation. However, elder patient, totally different. Lower compensate, the lower potential to healing. So, first, extraction. This failed anterior prosthetic area. So, however, this number, the 12 area, and number 21, this area is a big defect of the apical. So, it is impossible with immediate implantation with a perfect, proper positioning. So, I have decided delayed implantation. First of all, after extraction, remove all of these granulation tissues and pathologic granulation tissues. And after debridement, put the graft material here and apply the collagen graft. Collagen graft, just easy to handle and softer after soaking with blood or saline. So applied looks like here. Totally lap around this defected ridge is very important to use. And after that, the suture. So open healing status are possible. So let's see if this area covered with the conventional collagen membrane or some another different kinds of membrane, the barrier membrane, what will be happen after that? Maybe gone away all the graft materials inside this area to finally it is a little bit, looks a better situation finally. However, even though just not releasing incision, no anymore the flap reflection largely, and no periodontal releasing incision, just reflect, and debridement, put the graft materials and collagen graft, and suture. During the open wound healing process, after 1 week, looks like here. Don't worry about it. Don't worry about it. After these situations, first of all, actually I told you about rapid epithelialization. This rapid epithelialization potential from this collagen graft cover all these uncomfortable situation, right? So, 부용 단신. After that, we're gonna see these very nice, the homogeneous and host bone intermingled with this grafted bone particle. And the healing situation here, after 3 months, the actual 3 months is not enough, as you know. However, the trying to implantation with the secondary bone grafting procedure and implantation, the additional bone grafting, and the healing abutment connection. And finally, we're gonna have this final prosthesis. So, I wanna say about this keratinized gingiva. These anterior areas, as you know, is very difficult to get the aesthetic outcome after GBR procedure. Why? For the GBR procedure, as you know, the releasing incision and flap the folding and have some tension to have a primary closure. However, this one is open healing procedure. So doesn't matter any other flap replacement. So original locations stay there. And here, attached the gingiva, the keratinized gingival zone is very nice, still there. And we can get the enough volume of the soft tissues after 1 year follow-up. Okay, panoramic view. So nowadays, current trend is a little bit deep shifting to the plus the bright TL. This one is plus bright TL concept is my naming and not official naming. However, looks like here the very the ugly situation, the periodontal compromise situation. It is impossible to keep this lower anterior area, the teeth. So extraction and the irregular bone should be trimmed by the round bars. For me, actually, I always try to the black head, strong head, round bar, the lateral drill from the sinus simple kit for the lateral, the window, the grinding out the purposes. Sometimes I use this lateral drill for removing all of this irregular bone trimming. And after that, implant was installed, Bright TL. Bright TL is, as you know, the useful and versatile and very nice brand new implant system with the external connection. So just a simple contour augmentation is enough, not fully a general GBR procedure. Implant already surrounded by host bone. All the implant surfaces contact to the host bone, right? With higher initial strength, initial insertion torque. So just put this collagen graft with a damming and osteon geno collagen graft with the gap filling concept. That's it. And then, can you see? No vertical incision, no the periodontal releasing incision, no flap replacement, just a suture again. At this time point, I strongly commend you, if you want, if you can, wrap around the ridge with a collagen graft. That is impossible. That is important factor. Why? This collagen graft, initiate the rapid epithelial healing. So this collagen graft have a higher soft tissue healing potential. 10 days later, very nice, already done. All of these soft tissues are closed. So good healing and the faster healing is my key words to use these collagen graft materials. Okay, let's move to another case. What do you think about this one? Some doctors want to have an immediate implantation even though this large, big defect. So you guys have a higher the skill of, right? So the many doctors want to have an immediate implantation even though the big defect like this one, big extraction socket side. However, I want to try the delayed implantation after ARP for gaining the perfect implant positioning. So I have decided extraction, removing the granulation tissues, and bone grafting, and applied collagen graft, cover this socket area and suture, and waiting 1 week after applying this collagen graft. As you can see, as I mentioned before, these soft tissues are shrinking and open this surgical field. However, due to the rapid, faster re-epithelialization potential to cover all of this, the uncomfortable situation, so faster to cover this area. So finally, 4 months later, we got the very nice, beautiful, newly forming bone, this socket area, right? So if you want to have ARP for the delayed implantation, please try this collagen graft with the bone graft material. So we got the miracle situation. We will get the miracle situation. I promise you. Okay? And another case, similar to previous one, extraction. And this one is also the immediate implantation, also the delayed implantation case. However, for me, I want to have a delayed application for the three-dimensional perfect areas implantation. Actually, this socket is a type 2 socket area, so it is very difficult to have perfect positioning with a higher insertion torque. So bone grafting and the collagen graft applying. This one is X1D. This top portion, the dense portion, dense the layers always up to the socket area, right? So face to outside, the inner side contact to the coarse and loose area, loose layer. And hidden X suture, and wait, similar to previous one. Just 1 week and 2 weeks after surgery, you're gonna find out some little, wow, this one is also scary case. Actually, flap shearing case, and we can see the inside of sometimes you can see the graft materials, even though, however, just only 1 and 2 weeks is enough to recover all the epithelialization, right? And after that, a little bit more and more soft tissues, maturation, and finally, 4 months later. Actually, these 4 months later, the 4 months is deadline. The minimum during the waiting time for the ARP when you use collagen graft. And implantation, right? The final restoration. Okay? What about this one? A little bit difficult situation. First one, previous one is a simple, the socket ARP case. However, now it is a little bit more difficult and complicated case. You know, the vocal words gone away already. So it's tricky and some difficult case compared to previous one. However, I always try the same protocol and same procedure. Finally, covered with collagen graft. That is the same. Inner side a little bit different, depend on the socket situation. The smaller one and bigger one is a little bit different treatment. However, finally collagen graft covered all of this, exposed the socket area with hidden X suture, and 2 weeks later. Okay, see, let's see these very newly formed soft tissues are growing inside of this socket area, rapid covering the graft materials. Okay, and 4.5 months later, and well done, newly forming bone around here, even though the vocal walls can be survived and can be saved. So, by simpler bone grafting and simpler the collagen graft usage way give us acceptable bone quality. It is good to place implant. And I always try to host bone engagement in case of ARP because of the host bone is more stronger to have initial stability, as you know. So I always try to engage if possible. Okay, final illustration here. And what about this area? The keratinized gingival zone. It's very nice, or the harmonious compared to the neighbor natural teeth area, and good emergency profile. So that is my goal, to get this ALP procedure after extraction. So before extraction, the periodontal compromised case. After extraction, very big defect around here. So bone grafting and covered collagen graft and suture. That is my recipe. And I want to say about this socket packing protocol. For me, I always try to underneath the particle bone graft, the socket, the bottom of the socket area. Because of this particulated bone graft is more stable and more easy transformed to newly forming bone. And the upper part, collagen bone graft materials applied, about maybe 20%. And finally, the Dentium Collagen Graft, the overlying, the top portion of the socket. That is the last recipe, this bone packing. Okay, and the supine, undersized insertion, drilling and insertion, and the final prosthesis. Okay, what do you think about this one? The fistula already here, so the poor condition is very difficult. And extraction, vocal bony walls are gone away already. So the big defect around here. So all of these granulation tissues should be removed. And after that, what is next? Actually, there are many different ways to get the better newly forming bone condition. Depend on surgeon, depend on the professor. There are many different lectures already have, right? So for me, a simpler way, no flap reflection, just granulation and the trimming the labial this soft tissues area, and the damming with collagen graft. Collagen graft have some trim, and then the push into the vocal, the lost bony wall area for a damming, the preventing and the protecting this, the lost wall. And after that, the bone packing and wrap around the ridge. So like this one. So this one is very similar to concept, the ice cream cone technique, yeah, that is introduced by Dr. Dennis Tanau. The ice cream cone technique used the collagen membrane, the conventional type of collagen membrane. However, this one is collagen graft. That is different between the both of method. The material is different. Okay, 4 months later, what happened? Like this. So this one is not matured, not perfect, the matured newly forming bone. However, it is acceptable to have an implant installation on this perfect area. So the additional, the bone grafting again with osteogenic collagen, Actually, these areas, the collagen bond, osteogenocollagen is better to compare to the particle bone. Cause of this one is better to have the molding and protecting. And after that, adding some of brand new material. This one is PN. PN is higher, the bigger molecule compared to PDRN. The similar action maybe as a clinician. However, PN is a gel type, so easy to apply and stay there longer time. And just inject PN, the gel application, the top portion of the grafted material, and suture. That's it. And maybe this PN, the induce and the working, the top areas of graft materials, more the faster newly forming bone and the cell differentiation to have our familiar situation finally made. Okay, final illustration here. So what do you think about it here? Can you imagine these areas, the big fistula and the buccal bony were gone away, and the big defect? Actually, however, this area is very simple, simpler way by using collagen graft and another brand new materials like a PN and the collagen bone, like a collagen, osteogenocollagen, and final illustrations are here. That is my result. So, CT view here. Okay, sometimes I'm going to use this collagen graft to make soft tissue augmentation. Big defect here due to some of laxness labial bone. So took CTG from the palate and make a vertical to big incision and make a tunnel. And through this tunnel, put the graft first, the CTG first, inside the CTG, outside collagen graft. And the holding suture here, two holding suture, and the final suture. And during healing period, we're gonna see like the very familiar situation compared to previous one. And finally, we can get this situation. The 7 months later, follow-up photos compared to each other. So, the very nice, successful the outcomes achieved post 7 months pre-op here, and the volume enhancement was achieved, and also the creeping attach was achieved, right? So both of but the aiming target was achieved using the tunneling technique. To just make a tunnel, the collagen, this 2D is better to use, and go through all the way down there into the tunnel, and then the suture, that's it. Very simple way. Another case here, very thin biotype, the cause of the labial bone resorption. So there are many different ways to overcome this situation. For me, I have decided a simpler way, make a tunnel, and using the collagen graft to X2D. X2D is a little bit steeper than X1D. 2D is better to like this tunneling technique. So make through the tunnel and push the collagen graft 2D, X2D, and go through all the way down there on the opposite part. So suture, that's it. Just collagen graft the only case that the result of this only case is a little bit lesser than the combined with connective tissue case. However, simpler than the connective tissue case, the palatal pre, and the result is the maximize. Okay, 2 weeks later, 1 month, the compare to each other, the before, after. So we're gonna see clear, the little bit enhancement of soft tissue, the volume and tone. And I think the biotype was changed. Okay, so this one is using the case instead of collagen membrane. This digital guided surgery is the big equalize between the beginner to expert, right? Anyway, implantation, the helping the guided surgery, and then this big defect covered with bone graft, and sometimes I'm going to use this PDR lens soaking before applying this defect area, and suture, open healing technique was applied, and the position is very nice. Position was very nice, and bone grafting around here, and the healing situation, and the final, the result. Very nice, well done. Even though the open wound healing case, and final lacerations here. So let's see. If you have a collagen membrane instead of this collagen graft, maybe you need more the complex procedure, right? The vertical incision and the parasital releasing incision and the flap applying, membrane applying, and the pin fixation, like this one, and then the primary closure. All of these procedures are skipped, just using this collagen graft applying. Okay, so this one is evidence to have a successful GBR procedure using this collagen graft instead of a barrier membrane. Okay, both of the Kennedy class 1 case patient, however, nowadays, this patient have fixed the prosthesis. Okay, the failed, wrong position and failed implant. What is your plan? That there are many different ways will be achieved. However, extraction first and then next. Okay, sorry, just 3 minutes. I will finish, sorry. Okay, which kind of implant systems preferred? For me, in this kind of case, Bright TL is better for all of this. Bright TL is the good choice because of this restricted. Some have some limitation of ridge remnant. Okay. The narrow diameter 2 Bright TL was inserted, and this contained defect is easy to overcome. So this is one the published the paper here. So long-term outcomes parameter for this tissue level implant, and there are many factors to have to consider. This supercrystal tissue height is important, and the mucosal thickness is important to have a long-term success rate. And according to this paper, the result and the recommendation, I tried two tissue level implant with the collagen graft and also adding the bone graft. And the open healing technique, and that is a change, the paradigm change, right? The upper one is conventional GBR procedure, lower one, collagen graft plus bright TL procedure, and like this one. Okay, that is my final case. Enjoy this case. The full edentulous maxillary extraction first, and after healing period, and after that, the open the flap, and the beautiful, the bright TL was installed, right? The bright TL is a strong tool for me treat my elder patient and edentulous patient, like this one. A simple installation depend on reach. So I have decided, I have choose depending on the ridge width. And this narrow diameter, however, the platform is 3.8 millimeter, so the cover, the posterior area is enough. Okay, 6 implant installed, and the particle bone and collagen bone was applied already, and the damming outside with collagen graft here, and lab around all these areas using this collagen graft, a little bit bigger size. And looks like perforated of the sinus. However, as you know, no anymore the perforation, not at all. And the healing procedure, And the final, this one is actually temporary restoration. So patient so was good, and I'm so good at this treatment protocol. That is my summary. First of all, I want to say about this collagen graft is promote rapid epithelialization, vascularization, and osteoblast expansion. That is important to use, and we have to use this collagen graft, this kind of a big situation for elder treatment, elder patient treatment. Okay. Yeah, that is my recipe. Nowadays, I want to use a bright TL and bone graft materials, including the collagen bone, and finally, collagen graft added. That is my simpler way to bone grafting. Thank you. Thank you. Thank you for your kind attention. 谢谢大家。